Good morning, everyone. Welcome to the Dubai Government Excellence Program webinar. Today's session will tackle a new and interesting science, the behavioral science, the key concepts and its practices. My name is Dr. Marwa Shalwani, a general practitioner at Dubai Health Authority and proudly a participant at Dubai We Learn program as a team member within behavioral science for the government effectiveness team. And now I would like to introduce our unique presenter, Ms. Fatma Kawek. She is a behavioral scientist at the Ideation Center in Strategy and she is currently a PhD candidate in behavioral science at London School of Economics. She is among the first behavioral scientists in the region. Her previous experience include working as a behavioral scientist at the World Bank, Mind Behavior and Development. She was also the project manager to establish a Kuwait Public Policy Center at the United Nations Development Programme UNDP in Kuwait, as well as the Kuwait Behavioral Insights Unit. She led multiple projects and workshops across different countries in the region around behavioral diagnostic and design of behavioral interventions and experiments. We are really happy to have you with us today, Ms. Fatma. But before we get started, if you have any questions, you can feel free to type it in the chat box, and we will collect and address them at the end of your session. And now, Ms. Fatma, the floor is yours.
Thank you, Dr. Marwa, for your introduction, and I would like to thank all the attendees today to the webinar. I'm glad to be speaking in your webinar series, and I would like to also thank the Dubai Governance Program and inviting me for this webinar today. I'm sharing my screen. Can everybody see it? Dr. Marwa, is it shown? Yes. Excellent. So, without any further ado, so today's webinar is around behavioral science and governance, key concepts and application. What I would like to walk you through today a main introduction to what behavioral insights is and how you could apply it to your own government programs and projects. The agenda for today's webinar is first, we will go through an introduction to what behavioral insights is, so some key definitions. The second part would be just a brief introduction on how behavioral insights could be applied into government projects. Then we will move into some examples of behavioral interventions and solutions from successful benchmarks. And then we will end the session with some behavioral tools. So I want to leave you with some tools and methods on how to bring this to life in government projects. And we would like to introduce our own strategy and behavioral approach to do that. Before we start the content of today's presentation, I have a small riddle for you. So if you could please just scan the QR code and try in less than 30 seconds answer this riddle. So a bat and a ball cost $1.10. The bat costs $1 more than the ball. So how much does the ball cost? If you could just very quickly scan the QR code on Minty, and then it will take you to the Minty page and try to answer it very quickly. And then maybe Dr. Marwa, you could help us with gathering the main answers. So giving you a few more seconds. Yeah, any responses, Dr. Marwa?
Mostly 10 cents.
10 cents, okay. Let's move on. So the answer to this riddle is actually 5 cents. And just hold on with me a few seconds just to explain to you what happened here. So if you spent a little bit more time on computing this simple mathematical equation, you would find that the actual cost of one bat is 5 cents. Another riddle for you. Which circle is bigger? And here, please, could you also scan the QR code and try to tell me which circle you see is bigger, 1 or 2? And also, Dr. Marwa, I need your help in just gathering the main insights. Any answers?
Most people answered circle 1.
Yeah.
And only 10 people circle 2.
Okay, thank you. So what's happening here? Actually, the two circles are the same size. Moving on to the third riddle, and here I'll spare the time and just tell you which line is longer. And obviously, here now, at this point, you know that this is an illusion, and you know that line 1 and line 2 are the same size. but what you experience or what you see is different. So they are the same size, but you can still see that line 1 looks a little bit longer than line 2. So what's happening? We're experiencing two types of thinking or two modes of thought, okay, in our mental processes, leading us to different decisions and behaviors. Why? Because of the dual system model. And Daniel Kahneman, in his book Think Fast and Slow, explained it very clearly that we have two systems in our mind. And this is the main grounding theory in behavioral insights. And the reason why I want to present to you this dual system model for you to try to understand why we misbehave, why we behave the way we do, so that we could try to change behavior and behavior of people around us. So the dual system model tells us that we have two systems, system 1 and system 2 as humans. Very briefly, system 1 is our fast and unconscious system. We use it all the time. You yourself use it all the time. It's an emotional system, automatic, fast, and unconscious. So you wake up in the morning, you brush your teeth, you take the same route every day to your office. You're not thinking, you do it automatically. And guess what? It helps us. It is a really very helpful system for us to conduct our daily lives and chores. However, it comes with its own errors and its own errors in judgment, and what we call تحيزات السلوكية, cognitive biases. And these errors in judgment comes because we take the fast and unconscious decisions. And what happens in the first riddle and the second riddle, and especially in the bat and ball, I asked you in less than 30 seconds to compute the equation, and the first number that came to your mind is 10 cents. However, the second system that we have in our brain is a very slow, conscious, logical, and effortful system. And we use it also a lot of time. So if I ask you today to compute 14 times 27, you need your system 2 to do that. If I ask you to do 2 plus 2, you would revert to your system 1 automatically. However, system 2 helps you take a lot of good decisions, but it is a scarce resource. So it gets depleted all the time. So now I hope while you attend the webinar today, you will be using your system 2 to grasp and understand all of this material. If I ask you to go and choose a new house or property you want to buy, you would be using your system 2 to compute a cost-benefit analysis and try to see which house is the best option for you. So system 2 is needed, is reflective, it's for analytical thinking, but the problem that it's a scarce resource, it gets depleted. If you use it all the time, you will get tired. So most of our time, like more than 80% of our time, we are using our system 1. We're using our fast, unconscious, and emotional system. And guess what? Most of our policymakers, most of our decisions that we make at the government level assumes that we are always using a rational and slow and cognitive system 2. And that's what behavioral science is bringing on board. Once we understand that our behavior is not based on a rational and deliberative thinking, we understand why people misbehave, why they don't eat healthy, why they don't use their seatbelt, why do they take unhealthy and unsafe decisions, because they are relying on a fast system. So what's the difference between classical economics and behavioral economics, الاقتصاد السلوكي? Classical economic theory assumes a lot of assumptions about human behavior. So Adam Smith theory, Economics 101 holds a lot of different assumptions on how we behave as a human. Whereas behavioral economics brings a more realistic view of how we actually make decisions. So I'll walk you through some of the main assumptions just for you to see the difference between the two. And keep in mind the dual system model. Keep in mind system 1 and system 2. In classical economic theory, we've always assumed that people are perfectly rational human beings. We are perfectly able to make sound decisions because we use our system 2. However, in behavioral economics, we are predictably irrational. I can predict our irrationality as a behavioral scientist because I can understand more our cognitive biases. Again, التحيزات السلوكية that system 1 uses to understand why we are predictably irrational, why we tend not to stick to our diets, why we tend to sometimes cheat, why we tend sometimes to not eat healthy, and all of these examples. Second assumption is that we have unlimited capacity to make sound decisions. We can all the time take the best rational decision. However, in fact, we have a limited and scarce capacity. Again, system 2 is a scarce resource. Third assumption is that we are context independent. We are able to make sound decision regardless of the context within which we make our decisions. However, we are very much context dependent. Context really matters, and you will see in a little bit how. We have stable and well-defined preferences. So I will always choose the same behavior or the same decision regardless of the time. However, one of the most important behavioral biases and cognitive biases that we learn is that we are present biased. If I ask you chocolate or fruit, you will say chocolate today and fruits next Monday. I'll start my diet next Monday. So I seek immediate gratification for now and tend to discount the future more. So I will spend today for my holidays and I will save for my retirement next year, right? We all do that. And the last assumption, also one of the assumptions, is that we are consistent over time and we want to maximize our utility. This is what classical economics taught us, right? However, our decisions are influenced by the social factors. So if everyone around me is recycling, I'm more likely to sort my trash and recycle. If everyone around me is eating healthy, I'm more likely to conform. I'm also context dependent, so I depend on how and how environments are designed and how contexts are and processes are defined. So these are the main differences between the assumptions of classical economic theory and a more realistic view of how we actually behave in our daily lives. This takes me to another example. Look at these two people. What do you see? They're going to the gym. So obviously, they know and they realize the importance of being physically active, right? So they want to go to the gym, they want to exercise, they want to maintain a healthy lifestyle. So their system 2 knows all of this. They're well educated to know that they have to go to the gym. However, what are they doing? What is leading their behavior? They're using the escalator. If they were using their system 2 and they were conscious enough that they are going to exercise, they would be choosing to burn more calories by taking the stairs. However, what is leading their behavior? The context. Because there are escalators out there and there's an option, they took the default option and they took the escalator. So it very much contradicts their intentions to be healthy and stay active. This is just one example to show you that we are predictably irrational again. So in theory, classical economic theory, or us as humans, we always expected and assumed that our intentions would lead to certain action. So, give you an example. We all want to be healthy, right? We all want to exercise. We want to save for our retirement. We want to eat vegan. We want to wake up early. We want to recycle, donate, so on and so forth. And the assumption from a classical point of view is that our intention will translate into these actions. We will eat healthy, we'll go to the gym, and good luck with that. So this is the assumption. However, one of the main theories or phenomenon in behavioral science that there's a wide gap between what we intend to do and what we actually end up doing. Why? Because of our cognitive biases, because of the context within which we make decisions, and because we tend to just procrastinate, we're present biased, we project for the future, and we're loss averse, so on and so forth. So until recently, until like the last decade or more, public policy and decision making have been viewed from broken binoculars. We've been viewing the world, us as government officials, as policymakers, as decision makers, as leaders, from broken binoculars. We've been seeing it from a classical point of view, traditional economic theory, assuming that people, if I tell people, you need to eat healthy, you need to exercise, you need to finish your 10,000 steps, you don't need to be corrupt, they will just act based on these intentions. However, what we learn, and one of the most important things we learn in behavioral science, is that context matters. So put people in different contexts, give them different information framed differently, put them in a different processes, give them different brochures with different visuals, they will behave and they will decide differently. So context really matters. So now you're asking yourself, how can I, as a government official, apply all of these learnings from behavioral insights in governance? First, let's go one step back and then try to understand how traditional policy making works. So how do we, as policymakers, always do policies? How do we change people's behavior, or how do we influence people's behavior traditionally? Two things. The first one is regulation. You want people to wear their seat belts, you put a fine. You want people to use plastic bag, you let them pay 25 fils for it. You want people to eat healthy, not to eat sugar, you put a sugar tax. Easy. The second way is incentive. You give them subsidies, incentives, bonuses. Okay, take the reusable bag and I'll pay you, I'll deduct from you 25 fils. So it's just the other way of doing things. The third way is behavioral insight. And here I want to add 3 points. The first one is that behavioral insight is a complementary tool. It's not gonna replace the traditional policy making framework. So it's just a complementary tool. The second, it's not just only about understanding and changing people's behavior. It's also transforming governments' work and making them act as an experimental. So we create labs, nudge units and labs inside the government. So testing and experimenting. You cannot hire a behavioral expert that would tell you do this in Dubai. It doesn't work. We need to test and experiment on real people. So very similar to what we do in the medical field with randomized controlled trials, we do the same on actual people to try to test what works and what doesn't. And the third thing is that you're wondering by now, how do we do this without removing the freedom of people to choose? So it's a libertarian paternalistic approach. What do we mean by libertarian paternalistic? Paternalistic, as a government, I know what's better for my people. So I want to maximize their welfare and well-being. But I want to keep their liberty to choose. So what we do is that we steer people's behavior into the right direction by changing the context and the environment within which they make decisions so that their system one automatically will behave the way we want them to behave. Okay? So from now, I think you've heard a lot of terminologies: behavioral science, behavioral economics, behavioral insights, maybe nudge, maybe behavioral interventions. This slide is just for me to give you key definitions very simply. First one is, what is behavioral science? Just to tell you, behavioral science has always been there in the literature. So it's the study of psychology and cognitive science to understand why we behave the way we do and how we can change our behavior. This is just, it has always been there. What's new and innovative is behavioral economics, الاقتصاد السلوكي. Behavioral science, علم السلوك. Behavioral economics, اقتصاد السلوكي in Arabic. So it's applying the knowledge from psychology and cognitive science into economic field and public policy. The third terminology is behavioral insights, الرؤى السلوكية. So behavioral insights refers to the accumulation of the knowledge. So when we run the tests and experimentation, when we design policies and implement and measure the outcome of our experimentation, the insights we get are the behavioral insights. Whereas behavioral interventions are the actual changes, the treatment we're trying to treat people with to change their behavior. So it's like the tool or the solution we try to do. And we do it with experimentation. And here I want to just highlight a very nice word I like, is choice architecture. Again, because system one is very much context dependent, what we do is we change the context, the processes. So منهندس الخيارات, choice architecture. We become like architects, that we try to change the choices and the way, the design of processes to try to change behavior. Just briefly, four main criteria for a good behavioral intervention or a nudge. Small intervention has to be small, changes again the context and the choice architecture. It's cost effective, and this is very important. So we're not doing anything to really outweigh the return. So it should be cost effective. And last but not least, preserves the freedom of choice. So we really keep the autonomy of people to choose whether they want to behave the way they want to do. So how did this all came into really government and public policy? So two main events that took place. The first one is the Daniel Kahneman, who wrote the book Thinking Fast and Slow. Remember System 1, System 2. He's an economist. But he won in 2002 a Nobel Prize in economics because of his work in behavioral economics. So this was like the beginning of everything. Then the book Nudge in 2008 was also groundbreaking. It is co-authored by Richard Thaler and Cass Sunstein. I really invite you to read these books. Predictably Irrational is another very famous book by Dan Ariely, Thinking Fast and Slow again. And then it all came to government in 2010. Where Prime Minister Cameron and the UK government established the first behavioral insights unit at the heart of the UK government. And this was really another groundbreaking event. Then a lot of government followed after that. In 2015, the President Obama established its own nudge unit. Australia followed in 2016, and so many different governments, Singapore, Canada, Germany, Netherlands. The number is growing by the day. And then behavioral insight has also been integrated in UN organizations and NGOs. Richard Thaler, the co-author of Nudge book, also won a Nobel Prize. He's in economics in 2017. And this is where really the science or the field has been growing on very big momentum. It also came in the region in 2017. And now we've seen the growth of different behavioral insights units around the region. The first one, Qatar, in Saudi Arabia, in Kuwait, and in Lebanon, in Oman, and so on and so forth. How do we see the institutionalization of behavioral insights? So it could take different forms. First one is governments. As I said, you could have a nudge unit in a government, and we've seen it in so many different governments around the world. The second one is in research centers. So it's very much linked to academia and research centers. So now leading universities like Harvard, Boston, Cambridge, London School of Economics, Warwick, and so on, they have their own behavioral labs or research centers to apply behavioral economics. The third is international organizations. As I said, World Bank, OECD, UNICEF, the UN, the UNDP, and all of these big organizations, even WHO during COVID, they created their own departments, unit, and team members. And also we've seen the private sector, like social entrepreneurship companies that are trying also to apply behavioral science and support governments to do that. Just to show you here that BI is not a trend. And in fact, an increasing number of behavioral insights units have been created in the past 10 years. And we've seen this happening in every single continent around the world. And this is just a non-exhaustive illustrative map of this. Maybe you're asking yourself, how can we apply this in our own departments or governments? So we have different types of models different types of institutional models. The first one is a centralized one. And this is how it started in the UK, it started in Australia, even in the US, where they started at a high level government entity. And so the Prime Minister's office, the President's office, and very, very like executive councils, the center of government, if you want. And the positive thing about it, it gives you a high level of buy-in and coordination. And it's also support the use of BI across the government. The other model is a decentralized one, and these models are not mutually exclusive. And we've seen that the UK model, even the US, it started as a centralized, and then it got diffused in the government entities. And now we've seen that, let's say, if you go to the UK, every single department in the UK, the government more or less have its own behavioral insights team or unit. The good thing about it, it offers flexibility and more focus on specific areas. The last type of model is a network model. This is where we see collaboration within public entities and partnership. An example of this is the Netherlands. Here, I would like to just walk you through that behavioral insights really could be applied to every single sector, policy areas, every single challenge you could think of that have a behavioral root. So first, health and well-being. I can't emphasize enough the amount of examples that were applied during COVID on COVID-19 vaccination, increase the restrictive measures, and so on. Well-being and happiness, environmental friendly behavior, sustainability, public service government efficiency, public finance management, how to increase the collection of tax, how to improve government motivation, education, human capital, learning, economy, labor market, entrepreneurship, inclusion and diversity. Also, we've seen a lot of application to increase the gender equity, so on and so forth. I think by now I got you excited just to see how we could apply this in real life behaviors. So the first example I have for you today is a very famous one, and this is also a challenge faced by different European governments. And there's a very similar experiment done by the Behavioural Insights team in the UK. I chose the one in Australia. And the problem is that GPs, general practitioners, the doctors, they overprescribe antibiotics. And this is something faced by different public health authorities around the world. So doctors who say they are most familiar with antibiotic guidelines are the least likely to follow. Remember, system 1, system 2, they know they shouldn't prescribe a lot of antibiotics, but they end up doing so. So why? What they try to do is decrease the overprescription by running a behavioral experiment. So this is, again, randomized controlled trial, being in the medical field. We have a control group where we don't give anything, we call it placebo, and a treatment groups where we give the intervention, and we measure the outcome. This is exactly what we do in behavioral science by running behavioral experiments. So this is an example of behavioral experiment. We had a control group, GPs and doctors that were not provided anything. We just observed their behavior. And then we had four treatment groups. The first one is education-only letter. So they provided them with this letter. We're providing them information on why they should not give antibiotics, overprescribe antibiotics. Second one, the same letter, they just provided them with peer comparison. So what other doctors around them are prescribing, so just taking the benchmark. The third treatment was a peer comparison, so no education, no information, just peer comparison, plus a graph visually to illustrate how they are doing compared to others. And the last one was a peer comparison letter with no graph, and then just a delayed prescription. So if they want to delay the prescription by 1 week, it would help them just take the decision later on based on the symptoms. Before showing you the results, I want you to just scan the QR code and try to guess which treatment outperformed the control. So which treatment or behavioral intervention worked. And here also I need your help, Dr. Marwa, in telling us the results. So in less than 20 seconds, if you could just guess which treatment really worked. Any answers? Dr. Marwa?
So there is a tie between treatment 3 and treatment 4.
Excellent. Thank you. So moving on, all the interventions, so all the treatments outperformed the control. So in the no letter, the prescription was on average 109. However, all of them really helped decrease the number of prescriptions, antibiotic prescription, but the peer comparison plus graph, which is this one, because it was visual, it helped doctors reduce by 12.3%. So imagine scaling this up on a national level, and they did it in the UK, and they were able to save thousands of pounds just because they just subscribed less antibiotics and with a simple intervention. The other examples I have for you is on reducing the use of single plastic bag. I chose this example because it's relatable to Dubai now. So the minute I reached Dubai, I found that all the outlets and grocery stores are charging 25 fils for every reusable box. What's happening? They're using, so in this experiment, they're using loss aversion. What is loss aversion? Before I show you the example, I just want to show you a psychological bias, a cognitive bias called loss aversion. So we hate losing more than we love gaining. And this is also what we learned from human behavior. So just looking at this graph here, if I ask you all now that I'm going to remove from you 100 AED, you will feel more pain than when I tell you I will give you 100 AED. So the pain, we hate losing more than we love winning for the same amount. Understanding this from psychology and cognitive science, it helped the US. In the US, they've run an experiment and helped them reduce plastic bag use. How? So in the US, 365 Americans use on average, they use 365 plastic bags per year on average. In the Denmark, they use much less. So what they did is they ran another behavioral experiment using financial incentives design. So they changed the incentive through loss aversion. How? The first treatment, very similar to what is done now in Dubai, they gave them a tax, the 5p tax on every disposable bag. So every time you go to the grocery store, you get a disposable bag, you will charge an extra 5p for each bag. Simple, very similar to what's happening here. The second treatment, so they measured, they tested. So they didn't roll out the 5p, they tested which one would work. They gave them 5p bonus for every reusable bag. So every time I go to the grocery store and I use a reusable bag, they will deduct from me 5p. So I will take a 5p bonus. So it's the same amount. So I should be behaving, if I was rational, if I was using my system too, we should all behave the same way across treatment 1 and treatment 2. However, the results are quite fascinating. And the tax treatment, they were able to reduce disposable bag use by 40%, just because people hated losing the 5p. However, more interestingly, the second treatment, which is the bonus, for the exact same amount, 5p, there was absolutely no change between baseline and treatment. So people were not nudged, or they were not really incentivized to use reusable bags. So this just shows you that our system 1 responds more strongly to losses. Understanding that we are loss averse, we can change the way incentives are designed just to be able to change people's behavior in a very simple way. Last example I have for you is on organ donation, and this example is in Canada. So they have a very low registrations to donate their organs. And what they do is every time any Canadian or any resident goes to a public ministry or public office to run any service, they would ask them, whenever you reach the counter, they will give you this form and they will ask you, do you want to donate? So if we identify the behavioral barriers, شو المعوقات السلوكية in this process, before designing intervention. We find that the form is too complex. Like even for me, it's too complex for me to read all of this. Imagine I'm entering a government center and I need to run my do my papers, and they give me this very complex and complicated form. I won't be able to read it. I won't be able to understand. So there is an information overload, and there is a lengthy process because the service officer or the public officer has a lot of people in the waiting queue, so he doesn't have time to explain to me. And then some people, they agree to fill, but they end up not signing. So these are the main behavioral barriers out there. Although people have intentions to donate, so they want to donate their organs when you ask them separately, but they do not end up filling the form. So what they did is they ran another experiment. The first one is they just simplified the form. Look at this simple form. If you get this form, you're more likely to just tick the box or untick the box, but to take a decision, right? Because it's simple for you just to read it and understand. The second, they did the same, but they added this sentence here, like a behavioral prompt, a nudge. If you needed a transplant, would you have one? If so, please help save lives. Another one, they used reciprocity. How would you feel with emotions? How would you feel if you or someone you love needed a transplant? So just to make you to make your system one have those emotions so that you are more likely to donate. And the last one is, how do you think people feel when they or someone they love need a transplant? So also reciprocity and emotions. The last treatment I really like a lot is visually making it appealing. So one organ donor can save up to 8 lives. And putting it in a very simple form and very simple visual picture would help you really resonate with this and will help your system one process it faster. Registration rate increased by up to 143% compared to the control group. And the treatments that really worked the most were the flyer, the brochure, and this one, where they really felt and they resonated with the emotions and reciprocity. So just here to walk you through the main type of behavioral interventions they've done. So first, they simplified the form. They chose the right timing. They didn't give the form to people when they reached the service counter. They gave it to them when they entered the building. So when you take a number and you're waiting, during the waiting period, you're more likely to think, to read, and to try to decide. So the timeliness of the intervention is very important. A behavioral prompt, the reciprocity, emotions, and so on, and the salience of information, making it very relevant and appealing. So it increased by 143 registrations, but it's also expected to increase by less than 500,000 registrations every year if it was rolled out on all public entities. The next section is for me to give you some tools and some methodology on how you could apply this to your own projects and programs. So the Ideation Center as strategy, and we have developed our own framework to apply behavioral insights and to guide policymakers in applying this into their programs and projects. And it's called the 5 E's. And we thought that this is very easy for people also to just take it for their own projects. So first, we examine and elaborate. We try to define the problem from a behavioral aspect. We try to understand what we are trying to solve. Then we empathize and explain. We try to put ourselves in the user's perspective and try to see what are they experiencing and نعمل تشخيص سلوكي, behavioral diagnostic, to try to understand what's happening. Then we explore and elect. We explore solutions. We try to see what happened around the world, what are some type of ideas for solutions we could implement, and we elect and prioritize the interventions we want to test. And the most fun and interesting part, I'm sure you could resonate, is experiment and evaluate. This is where really you become a lab and you start experimenting on people and try to see what works and what doesn't. And believe me, it's so much fun, and you would enjoy the process because it gives you a lot of insight. And then you could iterate, you test, learn, you adapt again, you test, learn, refine again, and so on. And then you measure the outcome. The last step is expand and evolve. This is where we scale up. This is where we expand the application, either within the same policy area or across different areas. Let me walk you through one example so that you could see how this could be applied within your project. The first one is examining the problem. So you define the problem. So we as policy officers, or as policy makers and public officials, we try to too quickly go into the solving mode. We want to find solutions. So first thing you wanted to see today is, how can I apply this? What are the solutions? But in behavioral science and this framework, we have to go back one step and try to understand the problem from a behavioral aspect. So we use 2 approaches. a divergent and convergent approach. The divergent approach, we try to see what is the context, what are the needs, why is the challenge happening, what is the reason, what are the root causes behind the challenge. And it reminds me here of an example where they were trying to increase the payment of water bills on time. And when they dig more and they try to understand the challenge, they found out that the root cause of the challenge was not that people are not paying their water bills, but because they're not getting their water from the beginning. So this helps you really define what you're trying to solve. Then you convert, you try to zoom in, you try to see who is impacted, who are my target audience. Do I have a secondary influencing audience? So I want students in schools to get higher grades. But you know who is influencing them? The parents. So they are the secondary stakeholders. So I try to see who do I want to impact and who is influencing the behavior. Why is it happening? And what do I do if I do nothing? So if I don't try to intervene, what would happen in case of no action? So all of this would help me move from a policy objective to a targeted problem statement. And often we really receive a lot of policy officers or a lot of programs where they give us these big policy objectives. We really want to improve or increase gender equity in our country. This is very broad. It's a big policy area. What we try to do is understand what's the target behavior. So women wants to join the labor force, for example, and then try to identify a clear problem statement. So what do I want to solve in my behavioral experiment? Because I'm not going to be able to use BI to help women join the labor force. I need to have a very targeted project objective. For example, I want to increase the application of young graduate women, so women could have different personas, to advance tech careers, opportunities in the private sector. So this way, I have a specific stakeholder. That we move to the second step, which is empathize and explain. We try to really run a behavioral diagnostic to try to see what's happening. We do this using a very rigorous qualitative and quantitative methods. So we do focus groups, interviews, surveys, try to understand the behavioral barriers. Why are women not participating in these high-tech careers? Just to walk you through some example, one of the behavioral barriers is social norms. Maybe they are influenced by the social network in their environment that pushing them or expect them to have certain career choices or job opportunities. The other one is their own attitude towards it or their own heuristics. So they have underestimated capabilities. They have low self-efficacies. All of these are behavioral barriers that we could try to solve for. And the second step is we do a behavioral map. We do a journey map for a specific persona. So let's say Marwa is a typical young graduate in engineering from a local university in Dubai. And we really want to see what does she go through in her journey to enter the labor force, and try to identify the behavioral and the structural problems. Because sometimes the root cause is not behavioral. It could be structural. It could be that she wasn't able to continue her education, or she is unable to pursue a career in the city for so many reasons. But the behavioral aspect, we try to identify them and try to see the entry points for some interventions. For example, maybe we would need to increase her motivation to apply for a job. Maybe she doesn't have access to training and support program. You need to give her the information to do that, so on and so forth. The third step, once we identify the entry point for intervention, we explore ideas for intervention. And here it's based on so many different frameworks from the literature, benchmark from other countries and what was done in different contexts. We try to really come up with our own design. So we kind of do co-creation sessions where we bring the local people from local, from the youth, from local entities and NGOs to try to also explore ideas for solutions. So really we put the innovator hat on and we try to ideate as much solutions as we can. And then we elect and prioritize the solutions that are most feasible and experimented. Mindspace is the first framework that was created in 2010 by the Behavioural Insights team in the UK, and it provides a checklist, kind of a guideline for different types of behavioural intervention. So you could use the default option, you could use norms, so telling them more and more women are seeking jobs in technology careers, so on and so forth. Messenger, bringing the right messenger out there, commitment, emotions and effect, so on and so forth. So these are just types of behavioural intervention. We want to show you here some successful experiments to increase female labor market participation in the career, in the technology and career aspects. So what they did, so these are different types of intervention. I'll show you the priming. So what they did is they were hiding the candidate name in the US to try to decrease the biasness of recruitment. So recruiters usually are biased towards specific gender, name, ethnicity, and so on. And this by itself increased 40% the chance of calling women back. Another one is messenger. So using the right female messenger to also encourage women to attend staff recruitment sessions. So all of these are types of interventions that we could learn from and try to see what would work and what would not. Very important point I want to mention here is the for good ethics framework. So ethical consideration is very important whenever you want to run experiments, because you want to reduce the unintentional use of behavioral science. And for good is one of the ethical framework that is out there in the literature, and it walks you through different questions. And I always recommend either you could have your internal committee, ethical committee in the Nudge unit, or you could rely on a local university that has internal review board to get the experiment approved out there. The last two stages, I will walk through them very quickly because I don't want to walk you through how to do rigorous experimentations and statistical analysis, but just to show you that we do it in a very rigorous way. So the design of the evaluation method, running the pilots and testing, then refining again, so test, learn, and adapt. We really do a sampling exercise. We randomize people into different groups, and the golden method to do that is randomized control trials, but sometimes it could lead to not being able to randomize, so we could do a quasi-experimental design, pre-post, and so on and so forth. But the reason why I'm showing you this is just to show you that we do it based on rigorous statistical analysis. We run statistical tests at the end to see if we can generalize the outcome on the population, or we need to test again, increase the sample, so on and so forth. The last slide for us today is some lessons learned. And these lessons learned were gathered internally by our team from our experience in implementing, developing, and scaling behaviorally informed trials. First one is really, we highly recommend building strong relationship with our academia. Like implement or embedding behavioral insights into governments requires this, and this is what's nice about behavioral science, it's bringing academia, research, and evidence-based on board. The second one is start with quick wins, prove the concept. It should start with how does this work? So also you could build the internal capacity. The third one is strategic partnership and collaboration between entities and on the national level. Why? For example, you want to reduce obesity in schools and like nudge students to eat healthy. You are a public health authority. You cannot do it on your own. You need the Ministry of Education, you need local NGOs, you need the Central Statistical Bureau, so on and so forth. So building the right partnership to get the data and the right engagement is important. The fourth one is just put the hat again of an experimenter and an innovator, and you have to embrace an empirical and evidence-based approach. Just try to see what works and what doesn't. And last but not least is the behavioral diagnostics. So try to really understand rigorously and with evidence, why is the behavior happening? What are the behavioral root causes of your challenge before running into implementation and running experiment? And guess what? At some point, and in so many examples I've worked on in projects, it would be more than enough to just run a behavioral diagnostic. It would give the policymaker the view on where the problem is really happening. And then maybe sometimes you don't end up doing a behavioral experiment. You end up just doing structural reforms to just change some part or the others in the challenge. So behavioral diagnostic by itself is a big deliverable or a big insight that behavioral science or economics could bring on board. I hope I didn't take much time. I would like to thank you all for listening. I look forward to answering all your questions. And I also think, Dr. Marwa, you're going to put down the my email. If you have any more further questions you want to ask me, you could feel free to reach out to me directly as well. Over to you, Dr. Marwa.
Thank you, Fatima. Thank you, Fatima. Thank you for such an insightful and informative session, honestly. And I would like now to open the floor for our audience questions. And I have the first question. How can we use behavioral science in organizational environment to improve employees' productivity and efficiency?
Yeah, thank you, Dr. Marwa, for this question. So yeah, one of the main areas that could be where we could apply behavioral science is to improve the public officials' motivation and help the government officials be more motivated and succeed in their jobs. We have several examples, and we've seen this applied in several different contexts. But before giving you one example, the first thing we would do is run a behavioral diagnostic to try to understand what is the problem. So are government officials not motivated? Do they need more information? Is the job description clear? So we kind of do, again, a behavioral map to try to see what is going on. And then we try to identify what behaviors we want them to have. Do we want them to be expressive? Do you want them to be to have a higher teamwork? You want them to have a more leadership, more motivation, to have a service sector motivation? So what is really lacking, and how do we identify all of these barriers? Then we could run several interventions on the ground to try to maybe redesign the processes within which they work, try to work with HR and the local institutions, try to see how can we maybe motivate them to pursue their careers. Maybe we could use goal setting. One of the famous examples done in the US was with teachers, public teachers in the Ministry of Education. So they were having really low motivation. They were not motivated to teach disadvantaged students. And like the scores, the standardized tests were so low. What they did, they used loss aversion. And instead of giving them the bonus at the beginning of the year, at the end of the year, they told this small sample of teachers, we will give you the bonus at the beginning of the year. And if you didn't perform, i.e. your sample students, your average score on standardized tests of your students in your class did not reach the X average, then we will take the bonus back from you. So they used loss aversion to incentivize behavior. And this by itself led to 258% increase in the average score. So teachers were motivated to work more when their bonus was sent at the beginning of the year and they were fearing losing it at the end of the year. So these are small interventions that we could do in redesigning the process, redesigning the HR policies, just to motivate the team members towards their goal. But again, the first question we need to ask is, what are you trying to solve for? Motivation, absenteeism, maybe their officials are not attending, you want them to have more teamwork, more leadership, it all depends.
Interesting. And going to the second question, ما هي أهم المراجع للعلوم السلوكية في الحكومات؟
Sure. So one, you mean guidelines, and so we have a lot. First, we have a lot of books. The first book is Inside the Nudge Unit, written by David Halpern. So he is the head of the Behavioral Insights team in the UK. He wrote a book, Inside the Nudge Unit, after he established the unit, and it has a lot of lessons learned. We have the Nudge book, we have Misbehave. These are all guidebooks that you could walk you through the main maybe lessons learned or the main best practices. In addition, there are a lot of international also reports out there that could give policymakers ideas on what worked in different countries. And also what you could do is just really attend conferences, partner with the right behavioral insights teams, do a benchmark. There are a lot of guideline materials out there for you to look at.
And going back to the teacher example, we have a question, how sustainable is that approach in the long term?
That's a very interesting question, and I knew it will come from the audience. Every time we present this, we have the same question happening. So sustainability of behavioral intervention is a big topic now in the literature of behavioral science, because first, some of the behavioral interventions needs iteration. So you really need to go back sometimes after 6 months, because what would happen? People will get used to the message. And then you need to keep innovating and iterating. Again, this is innovation. You become like an innovation lab and you try to refine, iterate, because your system one could get used to the message and you're no longer really nudged or we say behaviorally treated. So one way is to, depending on the situation, on the challenge, you keep iterating and you keep, as a policymaker or as a behavioral insights unit, innovating. The second way is you keep doing that until it becomes a habit. The nice thing about the human brain is that we have habit formation. And I think by now you know where the habit lies, in system 1. So once the behavior becomes a habit after maybe 40 days, 50 days of doing the same behavior, let's say I nudge people to recycle. So I do all of these behavioral interventions to help people sort their trash and recycle. After some point in time, believe me, you would see that system 1 is now wired to have an automatic and unconscious process of recycling. So once you reach this as a behavioral scientist or as a policymaker, then you have succeeded. But there are some behaviors that requires really more interventions and nudging. So it also depends on whether you're trying to do one-time behavioral change, like vaccination for COVID-19. It's a one-time behavior change. I just do a behavioral interventions to increase vaccination. It's a one-time behavior. But sometimes behavior are not one-time. They require sustainability. This is where we either look at forming habits or we look at keep iterating. And sometimes you have to keep iterating, like eating behaviors, all of these things requires constant relook on refining the interventions. I hope it clarifies.
Yes, and going to the next question, it's quite interesting. Who is more to behavioral science mindset, males or females?
So I always get asked this question, but not in this way, not with gender and the gender dimension, but we get asked, does it differ from a culture or another, or does it differ from a nationality or from a context from the other? What we learned is that this is like like cognitive biases and the lessons learned from why we misbehave and we behave in an irrational way is really across the board. So if you take an American, an Arab, an Asian, is really at a macro level. We're not looking at the individual differences. We're looking at the macro level, how people behave in different contexts. But when it comes to the gender dimension and just seeing, like depending on again, one example, depending on the challenge, we've seen that women have lower self-efficacy than men. So not because women have lower self-efficacy, because again the context and the social network is driving them towards this end. So if we do a lot of behavioral diagnostic, we can find out that maybe, I'll just give an example, women in the Arab world might have specific behavioral barriers specific to the context within which they were raised that increase the susceptibility of specific cognitive biases. So answering your question, I don't have data for it, but you can find differences between not men and women, but between different sample of people because they were raised or they are in different environment, context, and social aspects. And there are a lot of PhD students who are working now. So I know a lot of researchers working on the difference in social context. So if you go to poor countries versus rich countries, so how does poverty and like the social context influence our behaviors and the way we perceive and we take decisions, how we are risk averse or risk takers. So all of these dimensions could be taken into account. But really on men and women, it's very broad. So it depends on the policy challenge again.
Very insightful. One more question. What are the criteria for having a successful behavioral insights team? You have mentioned the nudge units within worldwide. So what are the criteria to having a successful one?
Nice. Thank you for this question. So having a successful behavioral insights team requires like different things. First, we have to the innovators hat. So the team should be very agile, should have like a kind of the skill to really adapt to the latest, because the science is growing by every day and every year. So you've seen from 2015 until now, we've seen a big momentum. So we have to keep abreast of all these changes to be agile with the different methodologies. The second, a successful, I think, from my opinion, behavioral science team is one that is very diverse in terms of skills. So we don't only hire behavioral scientists. So we become behavioral scientists. So it's an intuitive science where we could train and have any public official become a behavioral scientist and look at the problem from behavioral lens. So a successful team would have a diverse set of expertise. So we bring maybe experts from different policy areas that would help us understand more what is, let's say, the education system problem, what is the health problem. The second, we would also bring statisticians, data scientists, psychologists. So a successful behavioral insights team doesn't always compromise just behavioral scientists. It should be complemented by experts in the different policy areas that will bring the knowledge and the know-how from the specific challenge, as well as psychology, cognitive science. You need statisticians for rigorous testing and experimentation. The third criteria, I think, for a successful behavioral science team is is being open to different partnerships, is being out there. The behavioral science community is very open worldwide. So you would see that all of them are very well connected, and you would reach out to different behavioral science teams, to different centers. So you should have this capacity to connect the dots between the different potential partners, and also building the right partnership internally. I cannot emphasize enough the amount and with the local entities, public as well as NGOs and CSOs that you need to make, so that you're able to, as a behavioral science team, to implement experiments. You cannot just sit in your department and try to do all of this. You have to go back out there and engage. And one of the lessons learned also from engaging with partners is building their capacity. Instead of knocking on the Ministry of Education door and telling them, oh, give me data on schools and cafeteria, whatever. No, I would engage them by building their partnership, by building their capacity and what behavioral insights is. This way we diffuse the science across different areas in the government. I hope I answered.
Excellent metrics, and I'm afraid we're running out of time, but we have a question. How we can keep the freedom of choice while applying the behavioral science?
Nice, thank you. Very easy. I'll give you an example, and I think it's just one of the most famous examples in behavioral science. They wanted in different countries to increase organ donation registration. So they just changed the default option. So instead of you needing to tick in putting the default option as opt-in, for example, so you would opt in to donate your organ, and if you don't want to donate your organ, you opt out. This way, I'm leaving you with the liberty to really tick out and opt out for organ donation. So what we really do is just هندسة خيارات, changing the choice architecture. I'm not obliging anyone to donate their organ. I'm just changing the way the form is done, changing the way information is provided to help you make better decisions, because I know that your intention is maybe to eat healthy, is to save for your retirement. So instead of obliging you or having like the carrot and stick method to just for you to behave the way you do, I don't remove the liberty. I just help you. I steer your direction, your behavior into the right direction. Another example is the famous experiment done with the behavioral insights team in the UK, and this was the first experiment to nudge citizens to pay their taxes on. What they did, it's a sentence. 80% of other citizens in your neighborhood, they pay their taxes on time. So you're not forcing them. You're not removing their liberty. They can still choose not to pay their taxes. They can choose not to donate. You're just increasing their or encouraging them or nudging them to take a specific action. So they can. How did I leave them with the liberty of freedom? I did not force them to pay their taxes. I just helped them make the right decision, and that's the difference. And again, choice architecture. It's not forcing the choice. Is architecting the process again to help them make the right choice.
And the last but not least question, how can we apply the same behavior intervention techniques to affect or change the management policies?
What do you mean by management policies?
Yes.
Yeah, that's a tricky question. Yeah, this is a tricky question, but it reminds me of a paper I read on that policymakers and leaders they are humans, right? So I'll answer the question in a different way. They also are susceptible on behavioral biases, right? They might also be present, they have the present bias. They could have hyperbolic discounting and all of these sort of biases. At the end, they're humans. The way behavioral science and what behavioral science is offering is experimenting and testing. So instead of me as a policymaker or as a behavioral scientist come and tell the Dubai government, you need to do 1, 2, 3, we're bringing evidence and empirical evidence on board to help policymakers take the right decision. I hope I answered the questions right. So a lot of reviews in the literature that policymakers themselves have their own set of biases. What we could do to reduce it is go back to the science, go back to the experimental approach, try to see what worked and what doesn't.
Thank you, Ms. Fatma. Unfortunately, we have come to the end of this interesting and insightful session. On behalf of DGEP team, I would like to thank Ms. Fatma for this insightful session. And I would like to thank our audience also for your active participation and engagement. Thank you, everyone, and have a great day.